Hey everybody, my name is Whitney McDonald and I'm a nurse practitioner student with Auburn and Auburn University Montgomery, and I'm going to take a few minutes out of your day today to discuss spinal stenosis. Spinal stenosis is the narrowing of the spaces within your spine, which can also cause compression of the nerve roots that travel through the spine. This most commonly occurs in the lumbar and cervical spine. And typically, spinal stenosis must be severe before symptoms occur. Symptoms associated with spinal stenosis include numbness, tingling, or weakness in the hand, foot, arms, or legs, trouble with walking or balance, and back or neck pain. In cervical stenosis, severe cases can cause bowel or bladder dysfunction. Lumbar stenosis can cause patients to experience cramping or pain in the lower extremities after long periods of standing, walking, or sitting. Risk factors for developing cervical stenosis include increased age, degenerative spondylosis, trauma, neoplasms, postoperative changes, obesity, and osteoporosis. In a patient that's being worked up for this diagnosis, the first key question I would ask would be, when did the pain start? I think it's important for you to always kind of know the onset of any type of pain presented, just because it can kind of narrow down whether it's an acute or a chronic problem. Usually spinal stenosis has a longevity to it. The second key question I would ask would be, does the pain travel? This can point out whether the patient's having lumbar stenosis, where they're experiencing not only back pain, but pain in their buttocks and hamstring tightness as well. And the third key question I would ask would be, do you have any numbness or tingling in your extremities? This helps determine if the patient is experiencing radiculopathy, which is a fancy term for nerve root pain. Three of the top physical exams that I would use when assessing a patient for possible spinal stenosis would be first starting out with observing their gait. This is important because spinal stenosis can affect a patient's ability to walk. Sometimes they'll present with an uneven stride. They'll keep their knee persistently flexed to prevent their hip from flexing, which in turn relieves a tight hamstring and decreases pain when walking. The second exam would include performing range of motion of the spine. In this event, when you ask the patient to perform back extension, then you would notice that they would experience increased pain. The third top exam I would choose to complete would be testing their sensory function. And this is important because it can help determine the level of spinal cord involvement. So treatment of a patient with spinal stenosis would include preferably non-operative treatment, which would be physical therapy, exercise, weight management, and medications such as Tylenol and NSAIDs, with an attempt to avoid narcotics if at all possible. If the patient's stenosis stabilizes with these treatments, then you would again avoid surgery. However, if you progress with severe symptoms such as motor weakness or loss of bowel and bladder dysfunction, then you would immediately, as a patient, you would immediately seek care. Three priority teaching components of this of spinal stenosis would include in teaching the patient and the family of what potentially serious symptoms are, which are loss of bowel or bladder, change in neurological status, and gait disturbances, as well as the side effects of medication used for treatment, such as Tylenol, NSAIDs, or narcotics. For example, with NSAIDs, they can include increased risk of bleeding, as well as narcotic use can include oversedation and constipation. And then last importantly, I would include clear guidelines for a patient's level of activity and exercise. This would include informing the patient of ways to alleviate their pain by flexing at the waist, which includes pushing a shopping cart, which could be a good excuse for going shopping, and lying in a flexed position or sitting. This concludes my 5-minute lecture on spinal stenosis. I hope it kind of gives you a glimpse of what you can look for in patients with this possible diagnosis, and I hope you guys have a great day. Thank you.